I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. Good afternoon. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. This meeting is being interpreted in American Sign Language by Kim Rich. Carlos Saraceda is interpreting this press conference in Spanish, and his mellifluous voice will be available on the county's website and YouTube page shortly after we conclude this press conference. We are here again today to provide you with the most up-to-date information about COVID-19 and the county's response. I think it's important to put a word on the feeling we are all experiencing at this moment. The word is grief. By giving this feeling a name, I believe it will help us manage the stress and anxiety we are all experiencing. David Kessler is one of the world's foremost experts on grief. He was recently interviewed in the Harvard Business Review and said, "We're feeling a number of different griefs. We feel the world has changed, and it has. We know this is temporary, but it doesn't feel that way, and we realize things will be different. Just as going to the airport is forever different from how it was before 9/11. Things will change, and this is the point at which they changed. This loss of normalcy, the fear of economic toll, the loss of connection. This is hitting us, and we're grieving. We're not used to this kind of collective grief in the air." David Kessler's recommendation for managing this grief is to acknowledge it, understand it has stages, and to move through it. The stages of grief aren't linear. We don't all move through them at the same speed. Each of us must find our own way individually and collectively as a community. Fortunately, our community has demonstrated it is strong and resilient. We have weathered very difficult challenges and emerged stronger and more united than ever. We will prevail and prosper through this pandemic. The sense of united purpose we are creating together, the recognition that we can do very hard things together, and the kindness and compassion we show each other together will give long-lasting meaning to this event. There are many people and organizations in the community that are working tirelessly to help those who are in need, to plan ahead and prepare us for recovery, and to keep us all focused on the most immediate responsibility we each share to protect one another. There are 3 simple things we need everyone to continue to do. Here's a quick mental checklist to use as a reminder. Number 1, please stay home as much as possible. Limit going out to only essential trips. When you have to go out, wear a face mask covering and stay at least 6 feet away from other people. Number 2, wash your hands. Don't touch your face and continue to keep disinfecting surfaces. Stores have now restocked cleaning supplies, so there are plenty of convenient options available again. Number 3, if you or someone you know feels sick, stay home and encourage your friends, neighbors, or coworkers to do the same thing. Isolate yourself in your home. Don't go out. Ask for help in getting food and medicine delivered to you. If your symptoms worsen, call your doctor and follow their medical advice. Finally, we're very fortunate that Santa Barbara County is home base for one of the premier humanitarian aid organizations in the world. Direct Relief International has been a critical resource in the ongoing effort to supply our local hospitals with desperately needed emergency medical supplies to fight the COVID-19 pandemic. Direct Relief International is assisting the pandemic response in all 50 states and more than 80 countries around the world. Its mission is to improve the health and lives of people affected by poverty or emergencies without regard to politics, religion, or ability to pay. Since its inception in 1945, Direct Relief has consistently responded with targeted medical aid following major emergencies. Yesterday, Governor Newsom's director of the Office of Emergency Services named Direct Relief as one of 5 very, very powerful and very, very helpful non-governmental organizations, which will be part of a new consortium to manufacture and distribute a huge new source of needed medical supplies to hospitals locally and throughout California. DRI fills hundreds of orders each day at no charge so the organization is able to aggregate the material, store it, pack it, wrap it, and ship it immediately. Direct Relief contracted with manufacturers to produce N95 masks last year and procured a cache in anticipation of the coming wildfire season in California. When the COVID-19 pandemic hit California, they were able to distribute masks locally and throughout the state. Our community is very fortunate to have Direct Relief's massive capability in our own backyard. I want to say thank you to Thomas Teig, Direct Relief's president and CEO, the board of directors, and the entire staff for being here to help us at this critical time of need. Now I'd like to introduce Dr. Vondo Reynoso, Director of the county's Public Health Department.
Thank you, Supervisor Hart. Today, we are reporting a total case count of 243 in Santa Barbara County. The ages of the new cases range from 20s to 50s. 10 of the new cases are people that are incarcerated at the federal prison in Lompoc. None of these new cases are staff of the prison. A breakdown of the locations of the other new cases will be shared in a press release to follow and on our publichealthsbc.org website. But of the 243 confirmed cases in our county, 113 are recovering at home, 40 are recovering in a hospital, and of that number, 18 is in the ICU, 9 are pending an update from our disease control team, 2 persons have unfortunately died, and we are happy to report that 69 people have fully recovered. I invite you to our website, publichealthsbc.org, for daily updates on the cases and the resources. Yesterday, Governor Newsom announced additional healthcare coverage for those impacted by COVID-19 during his press conference. The governor understands how critical it is for Californians to have access to medical services, treatment, and testing if they have symptoms of COVID-19. He is expanding coverage under the Medi-Cal system to make this access available to all through a process called presumptive eligibility, in other words, for emergency Medi-Cal. This will be available to all uninsured individuals, regardless of age, income, resources, or immigration status, and also to those who have private insurance that does not cover the diagnostic testing and testing-related services associated with COVID-19. This coverage will be available both in hospital emergency room as well as in an outpatient setting. Although the implementation date is April 24th, there is an interim paperwork process that providers can use for these individuals prior to the implementation date. The 5 healthcare centers operated by the county will be using this process, again, to ensure that everyone who presents with symptoms of COVID-19 are seen and do not receive a bill. These healthcare centers are in Carpinteria, at the Franklin Community Center, in Santa Barbara, in Lompoc, and in Santa Maria. Please call one of these health centers if you need help. Also yesterday, the California Department of Public Health announced the most recent statistics on COVID-19 for the state. As of yesterday, California now has 16,957 confirmed cases and 442 deaths. The state has started to report race and ethnicity of COVID-19 cases and deaths. This initial information, representing 37% of COVID-19 cases and 39% of deaths, show the race and ethnicity data is roughly in line with the population of California. Here in Santa Barbara County, we have begun a deep dive looking into similar data for our local cases. Our plan is to present the demographic data by the end of next week to our community. In this uncertain time, the Public Health Department is working tirelessly, not only to curb the spread of COVID-19, but also to collaborate with our fellow county agencies in planning for what the future might hold. At this point in time, It's very difficult to say when our community will return to normalcy that we all treasure. We want to ensure that our hard work of flattening the curve is not lost, and that we are mindful of how lifting the stay-at-home order changes the spread of the virus. We will be learning a lot from those areas in the world that are ahead of us in this trajectory of the pandemic. As a local health department, we are guided by the California Department of Public Health and the Centers for Disease Control and Prevention. Please know that we are in line with the state's recommendations, and we will remain in line with any adjustments that are made in the weeks and months to come. Thank you.
Thank you, Dr. Del Reynoso. Now we'll hear from Sheriff Bill Brown about the increased law enforcement response deputies are prepared to make to disperse group gatherings that hopefully won't occur this weekend.
Thank you, Supervisor Hart, and good afternoon, everyone. Let me start by saying that the COVID-19 crisis is far from over. We are still in the climb phase here in Santa Barbara County, and as you've heard, we're making great progress at bending the curve, but we haven't reached the peak yet. Once we do reach that peak, we have to continue our efforts as the rate of spread descends to the point where it is safe to begin returning to our normal way of life. The people of the county have done and are continuing to do an amazing job of complying with the public health officer's stay-at-home order thus far. We're seeing encouraging signs that our approach to dealing with this virus is working. But we cannot stop what we have been doing. If you are not an essential worker, continue to stay home until it is absolutely necessary for you to leave. Make trips outside to obtain food, medicine, and other essentials as seldom as possible. When you do go out, wear a face covering. In order to avoid cross-contamination, avoid visiting or eating with friends or family members who do not live with you. When you go out to exercise, practice social distancing and keep a minimum of 6 feet away from anyone who does not live in your household. This weekend is Passover and Easter Sunday, a time when many of us traditionally gather with our families and our friends to celebrate our faith, to gather for worship, and to congregate afterwards in groups. Please realize that we cannot do that this year. Instead, watch an online service. Connect with family and friends by phone or by video chat. If you do meet up outside your home, only do so in small groups while remembering social distancing. Remember to cover your face, stay at least 6 feet away from anyone who does not live in your household, and remember that the health order prohibits any group of more than 10 people from gathering at a time. I want to especially admonish our community not to congregate outdoors this weekend. Please do not go to the parks or the beaches to gather together. They'll be open, but only for individual or small group recreation. If you do go to recreate, practice social distancing. Recognize that if you're violating the health order, you may be contacted by law enforcement and asked to disperse. We'll have extra patrols out, as will lifeguards and rangers in all of these areas. You could be cited, and you could have to pay a fine of up to $1,000. There are going to be signs, just like this one, posted throughout the parks and along the beach access areas. So please recognize that this is not the time for us to return to the types of activities that we're used to on Easter weekend. I also want to take this opportunity to emphasize that because of the measures that we are taking with the coronavirus, instances of abuse in homes are likely on the rise. We don't know that for sure because this type of abuse is often unreported. And sadly, it's difficult for us to know the exact numbers of incidents. But as a result of this presumption, the District Attorney's Office and all of our law enforcement agencies in the county are launching a campaign in which we are urging the public, if you see something or if you hear something, say something. Say something by calling law enforcement. For emergencies, such as abuse or violence that is currently happening, we encourage you to call 911. To report abuse that has already occurred, please call 805-683-2724. That's 805-683-2724. Also, the District Attorney's Office has victim and witness advocates available around the clock. So if you've been the victim of abuse or you know someone who has, reach out to them at 805-568-2400. That's 805-568-2400. The types of abuse that we're talking about include domestic violence, child abuse, elder abuse, and animal abuse. And we have developed, and we hope that you will soon frequently be seeing, a video public service announcement, posters, and flyers that will be distributed throughout the county. Here's what they'll look like. First of all, our poster. The title of the poster, Hidden Abuse. On the top, photographs of children, of a child, of a victim, an elderly victim with a black eye, and a dog. The message, hidden abuse is a serious crime, and again, our slogan, the core of this campaign, if you see something or hear something, say something. And then the phone numbers to call, particularly 911 if it's an in-progress event. Next, let's take a look at the public service announcement video.
Movement restrictions aimed to stop the spread of coronavirus may be making violence in homes more frequent, more severe, and more dangerous.
If you see something,
Or if you hear something,
say something.
please call law enforcement. If you can't call 911, call a victim advocate from our office, 805-568-2400.
We need to support and protect one another. Be willing to make a phone call for someone who can't.
We will be there to protect you.
we want to emphasize that under the current circumstances, with most people staying at home, you may hear abuse, including violence, that might be in progress. If you hear that, again, we encourage you to call 911 and report it. If you're an essential worker, such as a cashier in a grocery store, or if you're standing in line waiting for an essential service, and you see an adult or a child or an animal that is visibly injured, bruised, or visibly frightened or acting unusually, please report it by calling law enforcement or calling a victim witness advocate. Many mandatory reporters, such as school teachers, recreation staff, and others, are at home themselves now. So you could be the only person that might be in a position to see and report indications that a serious crime is occurring. By reporting it, you may just save someone's life. In closing my remarks today, let me say that many sacrifices have already been made, and many are yet to be made before this crisis is over. Perhaps the most important thing moving forward is that individually and collectively, we must continue to invest in isolating and social distancing. What we continue to do in these areas will curb the rate of the virus's spread, prevent our healthcare system from being overwhelmed, safeguard the most vulnerable members of our community, and ultimately save lives, many lives. It's incumbent upon all of us to do our part to protect our families, our friends, our neighbors, and ourselves. Stay healthy, stay responsible, stay hopeful, and stay at home.
Thank you, Sheriff Brown. And please share our thanks with the outstanding men and women of your department who are working every day to keep us safe.
Thank you.
With Easter Sunday coming up this weekend, I asked Father John Hedges from St. Athanasius Church to speak about how our local faith community has united to create meaningful Easter celebrations that connect us and also protect us from physical distancing.
We are stronger together, safely apart. Can it be that in our season of distancing, we discover somehow the very purest essence of our community? Can it be that as we are asked to fast from contact, we may connect more fully with all? Can it be that we might offer the sacrifices that we have been asked to make as if out of love for the life of all of our neighbors? Certainly we have found in these days an appreciation of those who cannot shelter from exposure, but continue to serve in harm's way on the front lines. Our brave warrior champions in armor of cotton, the doctors, nurses, techs, EMS, fire, law enforcement, and yes, delivery persons, janitors, grocers, pharmacists, and those who with tears must care for those that we have lost. If we cannot serve with them, we must stand with them in the solidarity of our hearts. And if somehow there is some benefit that is conferred in this crisis, it is that in this holy season, we all have been given a holy opportunity to embrace a deeper, broader community that is beyond anything parochial, that is beyond anything partisan. And this I do believe and declare in this season. This I believe is the fulfillment of the seasonal aspirations of each of our religious faith traditions, and yes, also of those whose faith is humanity. May our hard-learned lessons be remembered when this storm has passed. As this has been a season where we must refrain from embracing, one day we shall again embrace with even greater joy, for we are stronger together while safely apart.
Thank you, Father John. That's the most important message of all. We'll now take questions from the room. Mr. Molina?
Sheriff Brown, I was wondering what the policy is for deputies traveling in one car. Some people have told me they've, seen multiple deputies in one car. What is the policy in terms of the social distancing there?
We have encouraged our staff wherever possible to not double up in cars, to be one person to a car during this crisis. We've also encouraged them to not carpool to come into work. But we do have a number of sheriff's deputy trainees who are out in the field, and because they haven't concluded their field training yet, it's a requirement that they have a field training officer with them. And so if you see two deputies in a car, that's more than likely what is occurring right there, because one of them is a trainee.
Okay,
Yes.
One more question. I know that you said next week there'd be a more thorough demographic report, but do we have any numbers today on healthcare workers who have tested positive, local healthcare workers who've tested positive for the virus?
Yes, so as of today, we have 37 healthcare workers as cases.
Okay. Okay, thank you.
Mr. Dreyfus?
Just about the Lompoc prison, I guess this is for Sheriff Brown. Has there been, with the increase in number of, what else is being done to help sustain and fix that problem?
I think Dr. Del Reynoso might.
Yeah,
able to help
I'm going
too.
to pass that question to Dr. Reynoso, because she has been in communication very closely with the prison.
So our team has been in very close communication with the Lompoc prison, and we are making our healthcare center available as a testing site for the staff. We are consulting. They've asked for our advice and guidance on how to stand up a medical center on their grounds. So we have provided the structure for that. If they are needing resources from Sacramento, we will be the ones to facilitate those material requests. So we are in very, very close contact with their leadership and their team.
Thank you. Any other questions here in the room? We'll go to the phones.
Yes, we have Laura with Santa Maria Times. Go ahead.
Thanks. Yeah, my question is regarding the Good Samaritan Shelter in the county and their potential status as a direct relief organization. Because I know that they are lower on the priority list for receiving PPE because they're not designated in this way to receive, donations of PPE from FEMA, and that the executive director of Good Samaritan said they were trying to establish a contract with the public health department and maybe outside of the department as well to be able to get this designation. Can you speak a bit to what that process would look like and if that's a possibility and how the public health department could assist with that?
Yes, so we recognize that Good Sam is an incredibly valuable partner, and as such, we have attempted to meet their PPE requests through our medical scarcity resource group. We have a method of facilitating requests that come in, and we are working with Good Sam as well as other partners to be able to meet their requests.
Okay. Are there discussions, however, going on right now? And I don't know if this would be a discussion that takes place between public health and Good Sam, but are there discussions taking place to establish some sort of contract to more steadily provide them with these supplies or establish them as a direct relief agency?
Yes, so it's not necessarily with regards to meeting a critical partner's needs for PPE. It isn't a contract or it isn't a lengthy legal process. It's simply as them submitting a request of what their needs are, and the committee allocates the resources as they are available. And so, yes, to your question of are we in communication with them, we are in communication with them as a public health department, but I also know that we are in communication with them as a county for emergency response.
And we're very grateful.
Great, thank you.
Other thing I'd only add too, Laura, is that we're very grateful that the Good Samaritan Shelter operations have transitioned to their leadership, and they are doing an excellent job, and we really appreciate their help.
Mm-hmm. Okay, thank you so much.
Next, we have Tom Bolton with Newshawk.
Hi, good afternoon. I'm wondering if you can give us an update of what's happening with the assisted living and skilled nursing and group homes in the county. I heard that Valverde was completely locked down as of yesterday, and I'm wondering if there's been any cases in any of those facilities and sort of what the status is.
I can tell you that the only outbreak that we have in the county that is confirmed through cases and lab reports is in the prison. So I am not aware of any other reports of skilled nursing facilities having cases.
Okay, thank you.
That is all the questions we have on the phone.
Well, thank you very much for coming today. Our next press conference will be held tomorrow at 4:30 p.m. Here in the same location. Next Monday morning at 9 a.m., the Board of Supervisors will receive a presentation on COVID-19 response, so there will not be a press conference Monday afternoon. The regular daily 4:30 p.m. press conferences will resume Tuesday through Friday next week. The phone numbers and website addresses of the many information sources about COVID-19 will appear on the television screen after this press conference ends, and they are available on the county's website as well. Please stay healthy and apart. Thank you for joining us today.